Cold does a better job than almost anything else after knee replacement. It keeps the swelling down, and swelling is what drives most of your early pain and stiffness. So if you ice well, the first few weeks get more comfortable and you move a lot easier. Here's how I tell my patients to do it. I am Dr. Corey Calendine, an orthopedic surgeon in Franklin, Tennessee. This is my independent clinical perspective, and it's not a substitute for advice from your own surgeon. Let's start with the why. After surgery, swelling and inflammation peak that first week or two. That swelling is what makes the knee feel tight, hot, and sore. It's also what fights against your range of motion. Ice calms it down. Less swelling means less pain and easier bending. So icing isn't a luxury. It's a part of the work of recovery. Now, the single most important rule, and I mean this one, always put a barrier between the ice and your skin. A thin towel or cloth, that should be enough. Never lay ice or a frozen pack directly on your bare skin. Cold can burn the skin, just like heat can. And a numb, fresh post-surgical leg won't always warn you in time. Protect the skin every time. So how often should you ice? Ice when you're resting throughout the day, especially after you've been up walking or after therapy. That's when the knee swells the most. Use it in sessions, not for hours at a stretch. Let the skin warm up in between those sessions. You don't need a stopwatch. The goal is steady, repeated cooling, not one long marathon session that risks the skin. A lot of patients ask about ice machines. The cold therapy units with the cuff that wraps around the knee, they're nice. They're really nice. They make icing way easier because the cold stays consistent and you're not up a lot refilling the bag. But they're not required. A simple bag of ice or a bag of frozen peas can work well too. So if you choose a machine or a bag, the same rule applies. Keep a barrier against the skin and check the skin frequently. What about sleeping with ice on? Now, be careful here. I don't want a cold pack sitting against your skin for hours while you're asleep and can't feel it. If you use a cold unit overnight, set it up so the skin is protected and you're not at risk for that cold injury that we keep talking about. When in doubt, ice well before bed and let it come off as you fall asleep. You don't need to ice forever. The first couple of weeks, when the swelling is at its worst, that's when ice earns its keep. As the swelling drops over the following weeks, you'll reach for it less. Actually, maybe after just a big day while you're on your feet, and that's normal, and it's a good sign. One last thing, ice helps with comfort and swelling, but it's not a substitute for the rest of your plan. Your activity, your motion exercises, your pain medicine if you need it, and stop icing and call your team if the skin changes color, goes white or blistered, or if you get that numbness, that feeling that just doesn't come back even when the skin thaws. Those are signs of too much cold. So keep it simple. Ice to control swelling, always with a barrier, in sessions throughout the day, and ease off as the swelling settles. If you want to walk through your recovery, the link to schedule a consultation is in the description. But either way, I hope you'll come back here. Thanks for watching.